I was diagnosed with scoliosis. We just did what we could, so I went to the chiropractor since I was like preteen. There's a lot of like mountains and volcanoes in Indonesia. I guess it affects like my ability to be able to like conquer those mountains because I get sore in my back, and then I can't sleep on like a normal sleeping bag. I have to be like a princess about it and get like a mattress. And that's hard to do. People can't carry a mattress around. So yeah, I guess it affects like my leisure, my downtime.
When patients move out of the teenage years into the adult stage, you're normally told one of two things. One is, don't worry about your scoliosis. It's not going to get any worse, and there's nothing you need to do about it. And even if you did, there's nothing you can do about it because you're no longer growing. However, what we do know what happens in the adult stage, unfortunately, is continued progression. And we know that as the curve progresses in the adult stage, it's more likely to cause pain and discomfort like it was with Carissa. And therefore, they're normally told, okay, well, we'll wait for it to get bad enough, and then we'll consider spinal fusion then. At this point, we want to try to reduce the curve because we know patients' curves can respond in any age because we're using corrective techniques. And that's the key.
I found Scoliosis Reduction Center through a lot of research. It takes me pretty long to get here. This time around, it was almost like 50 hours. It's worth it. The improvements that I receive here, it's worth it.
We're not just treating the symptoms of the scoliosis, we're trying to reduce the size of curvature. And this requires very specific type of care. This is why Carissa travels. This is why many patients travel from all over the world to come to my clinic to get this type of treatment, because we're going to reduce the curve size, which is what's going to lead to results.
The process of treatment here can be fun. It depends on who's around, the different patients or clients here. Some of the machines are actually not as bad as I thought they would be. Like, it looks scary through the pictures, but once I'm actually on it, it's fine. It's not comfortable, but it's not painful either, so it's pretty bearable. When I started care here, I was at 47 degrees. I was recommended for surgery by a spinal surgeon in Jakarta, but I chose to do this instead. And now I'm in my, I think, like late 20s. So it's been like a 20-degree change. What motivates me is the possibility to be able to improve my spinal curvature. It's amazing being able to see the before and after shots. I still don't hike as much as I want to, like long distance, like short hikes are fine. But I don't feel pain anymore like I used to. I don't get sore as much. There's definitely a noticeable difference than before.
What we find with adult patients, when we reduce their curves back to where they were closer when they were actually growing and developing, their symptoms get better. They get more functional. They can start doing things that they couldn't do anymore.
I just always recommend this place to like my friends and family that have scoliosis, even if it's mild, because it can make such a big difference, and it's definitely worth it. So yeah, I just have good things to say about this place.